Poople's cat, meow, and Mr. Bear. So I'm going to talk about colds and flu, and I'm going to talk about antibiotics because I think it's useful topics to talk about. One of the things people do is that they buy fish antibiotics. I actually think for an emergency preparedness thing, so if they cannot get human antibiotics in a major situation, they can treat themselves with fish antibiotics. I think that's a great idea. It's a really bad idea. It's a really bad idea if you don't know what you're doing. A lot of people say get drug books and stuff like that, and that's a great idea. A lot of the drug books people are buying are actually meant for doctors, and it's just all text. Really bad idea, unless you're a doctor. Nurses have textbooks like this. This is Elsevier, Skidmore. You can get these reasonably cheaply, and it doesn't really matter what type you get. What I would do is I would look at it first if you can, and see if you can find drugs in here that you know of. If you can find them easily, then that's a book for you. They all have different slight approaches in how they index and how they label themselves. You do not need to get a 2018 book. You can get a 2015 or 2014. They'll be fine. This is 2016. Because of my job teaching nursing, I get stuff like this free, which is great for me, and I usually give it to poor deserving students who don't have much money but who are keen and eager. That's why I do my spare books, so I'm afraid I don't have any for you guys. But you can get them secondhand easily enough. For example, why would I recommend a book like this that's designed for nurses? Say you're interested in giving doxycycline to yourself. Well, first off, you have to know why you're giving doxycycline as opposed to penicillin or as opposed to amoxicillin. And you need to know if the medication you've got is actually doxycycline. So one of the good things with this book is it actually gives you a list of types of make, but brand name, as well as the actual name. And it tells you what you might confuse it with. So if you have doxypin or diclomide, you may give it yourself and it's not the right drug. It tells you what it does, which is you don't really need. It tells you what antibiotics it affects, what bacteria it affects, and tells you the unlabeled uses. For example, the unlabeled use for doxycycline is Lyme disease, so that's always useful to know. And elephantitis as well, which is actually Bancroft's filariasis. So if you get elephantitis and break down, doxycycline. Do not give it carefully if you're breastfeeding, give it carefully if your liver's packing in, and that's pretty much true for almost every single drug. Avoid excessive sunlight, and if you've got colitis, it's probably not going to help you very well. It tells you the normal doses, both intravenous and orally. That's a really useful thing to have because people will be given prescription bottles and the dosing on it may not actually be suitable for them as an adult or as a child. And it does tell you adult doses and adolescent doses as well, which is great. It tells you the side effects, tells you how often to use it. Sometimes it tells you other things like do not break, crush or chew the caps. You may crush the tablets and mix with food. So that sort of information is useful and tells you how to make suspensions of it, tells you how to do stuff like this. Tells you IV compatibilities, you probably won't need that. Tells you the side effects, so you know, anorexia, nausea, vomiting, pretty much every single drug, but it'll tell you other things which you might want to know. Under the age of 8, it will cause bone growth retardation, which is also useful to know if you've got young children. It tells you how long it hangs in the thing, it's protein bound, it crosses the placenta and it enters breast milk. So it tells you all of this stuff you might want to know in an easily read format. The better types of this drug book cost more money, and they actually will have pictures of the actual usual drug on them as well. That's kind of sort of semi-useful, though you've got to be careful with that. And tells you the nursing considerations, you know, and this is useful. It tells you what you need to teach families about if they take this drug. And one of the things that doxycycline can cause, if it's expired, it can cause Fanconi syndrome, which is actually, it's actually a kidney failure that if you stop the drug, usually will reverse. So some of the side effects, some of the contraindications. So get yourself a drug book like this if you're going to use antibiotics or any medication in grid down and you haven't got a doctor or a knowledgeable nurse available. Remember, most nurses will not have this in their heads, right? The other thing I do recommend you get is, again, yeah. So this is a free book from the School of Nursing, and it has basic nursing care in it. Basic nursing care, basic anatomy and physiology, and gives you highlights of what people should and should not be doing. For example, the ability to handle day-to-day challenges at work minimises stress. Yeah, right. Tells you some occupational diseases that you might get, tells you stuff like that, tells you how to give oxygen, tells you how to position people, tells you how to evaluate people. The other book which I didn't drag up is a book that you might want to get, is a textbook. And again, buy them second hand, right? Buy them really second hand, buy them cheap. Is one on assessment. How to assess a human body, how to assess eyes, heads, fingers, toenails for bleeding, for infection, all that sort of stuff. Is a useful book. And if you really want to go the whole hog, and I think if you don't have medical or nursing or veterinary in your toolkit of people that are going to be around to help you in a major emergency where those things may no longer be available to you for a period of time or perhaps forever, there's a really good pathology book, Pathophysiology. It's boring for most people, has pictures in, it's designed for modern medicine, but at the same time, the actual ability to be able to read this stuff in grid down, to figure out if somebody's got heart failure and what drugs you might have available or what medications from herbs that you can use to help treat their symptoms, how to actually test their blood pressure, how to figure out what's going on with different types of disorder in different parts of the body, absolutely priceless. So yeah, I hope you enjoyed that. For me and Mr. Bear, we are now going to shoot a video on flu and colds because I want to, and we're also going to shoot 1 or 2 videos on antibiotics. I do recommend that when you do buy those books and you do use those books in grid down if you're going to self-medicate. I really do. I'm not a doctor. I don't recommend that you self-medicate, but you might have to. And if you have to, I'd rather you do it sensibly than not. Now do remember, if you take any of the advice I'm going to give in the next videos seriously and you suffer consequences from it, I'll probably sue you for being stupid to follow somebody on the internet's advice. Au revoir.